Hello friends, today I will make a series of videos related to cupping. I will explain what cupping is, I will explain when it's most effective, and I'll tell you how to do cupping, and then I'll tell you 5 different cupping methods that I use, and I'll give you my personal testimony related to cupping. I've been doing cupping for like over 30 years, not to tell you how old I am, but I'm kind of old. And the information related to why cupping works and how to do it and when not to do it is based on this book. It's a Polish book by a medical doctor, and those of you who do not read or speak Polish would not be able to read it, but I'm just gonna give you like a book review of this book, and then I'll show you how I actually do the cupping. So please like the videos and subscribe, and thank you for watching. So let us begin. First of all, this book by a Polish medical doctor, SADLON, and the book is entitled The Most Effective Weapon of 21st Century, the Immune System. Well, the title tells you all. Our immune system is what keeps us healthy, and cupping is an excellent, safe way to stimulate that immune system and to make it work for us, not against us. And cupping is just one way of bringing this immune system to its full potential and bringing it in the time when we need it the most. So, healthy immune system, healthy body, happy life. So how does this tie to the cupping? Well, cupping is like century-old method used by the Chinese, by Polish people all over Europe to help the immune system maintain healthy function. And I'm gonna make a series of videos about cupping and divide them into short sections, so you don't have to watch the whole thing. Just if you want the theory, this is the part that deals with the theory, why cupping works, how it works, how to apply it, how not to apply it. And then the second portion will be actually I will show you how I do the cupping on various parts of my body, and that will be more like a practical guide. But at the very beginning, I just want you to realize that this is just for your information. It's not meant to be a medical advice. This is to just give you some idea about a technique that is called cupping. And then I encourage you to learn more about it, to talk to your medical doctor or physical therapist, and never stop any medications or, manage your medications without consultation with your doctor, and do not do cupping without first talking to your doctor about it or a physical therapist, because physical therapists are trained also in doing the cupping. But you don't need to be medical doctor or a physical therapist to actually do the cupping. It's very simple. It's enjoyable. I've been doing cupping for over 30 years, not to tell you how old I am, but I'm an old woman, and everybody around me ever since I was born was doing cupping, so it's very widespread practice, but kind of kept secret. I noticed here in the States, almost nobody that I talk to knows about cupping. So I wanted to share what I know, and I wanted to share with you a review of this book. It's written in Polish, so you won't be able to read it if you do not speak Polish. And then I hope you enjoy it. Please like the videos and subscribe. So according to this book, Dr. SADLON says that the basic principle in cupping, this is a basic glass cup. You create negative pressure system in the cup, and then you apply it to the body, and this negative pressure system just sucks in the skin, and that creates like minor injury to the tissue, to the area here. And that injury stimulates certain reactions in the body. And those reactions is what we're looking for. First of all, the first reaction is this reflexive reaction that there's increased blood flow to this area and beyond. That just happens spontaneously right away. Then the second reaction is that low red blood cells that go through those low capillaries in our skin are released into the tissues, and that creates a bruise. And the common understanding is that the darker the bruise becomes, that means the area is more sick. So our goal is to have as dark cup as possible, because that means that this stagnated blood has been released and it's in the tissue creating this bruise. And that's something that we want, because new blood flows in and the healing of the tissue happens after that. So the first response of our body when the cup is applied is this reflexive increase of blood flow to the area. Second is this leakage of red blood cells into the tissue, which is demonstrated by bruise, creation of a bruise in this area. Stimulates inflammation, like a little bit of swelling in the area and inflammation. And that inflammation leads to release of inflammation factors, which mostly are like histamines. So those histamines are being released into the area. And once those histamines are being released, that activates immune response. And then depending on the size of the area of cupping, like if you cup the whole back of somebody, or if you just cup their joint, that response may be local or it may be general. And we call it like a non-specific immune response. And this non-specific immune response has a very positive effect on duration of the disease that we are undergoing, or even to prevent becoming sick. So these mediators of inflammation, like histamines, are being released due to minor temporary injury to the area. Like we're creating this bruise, which is like a injury to the epidermis and dermis, and that small temporary injury stimulates the release of histamines, in turn activates the non-specific immune response. In those, in the walls of the capillaries in our skin, we have a type of leukocyte, which is one kind of white blood cell, which is a part of the immune system, that's called monocyte. Those monocytes are just inactive in the walls of the capillaries in our skin. And then when we have those histamines floating around in the blood, right there in the area of the cupping, those monocytes are becoming activated. And once we activate them by those histamines, they become macrophages. And macrophages are those big white blood cells that eat everything that they meet, like viruses, bacteria, funguses, cancer cells, foreign bodies that cause allergic reactions, and so forth. So those macrophages are actually what is fighting the infection, the pain, the inflammation. Those are the beneficial cells that we want activated. But by placing the cup, by causing the localized injury to the tissue and localized inflammation, release of histamines, or release of those inflammation mediators, we cause the activation of monocytes that are in the lining of the capillary walls in the skin, in the blood vessels in the skin. We activate those monocytes, they become macrophages, and then those macrophages do the work for us. They like consume, I saw a video of those macrophages like chasing after like a bacteria, chasing after it, and then like encapsulating and eating it. This is just amazing video to watch. Like those macrophages are like those big white blood cells, and they like chase after those foreign bodies or bacteria, viruses, funguses, cancer cells. They go like around them, they eat them, and that's how it works. And then those active macrophages, in addition to like eating those foreign bodies and bacteria and viruses and cancer cells, they also release those mediators of inflammation. They are called pyrogens, and those pyrogens like start the whole immune reaction in the body. So more and more cells are coming to that area to fight the whatever is bothering our body in that particular place. So we have this like whole army of our immune system going straight to that area and healing it and bringing more blood and bringing more nutrients, more oxygen, and then the area just heals. And isn't that amazing? And all you need to do is just make this little cup and then stimulate this release of those inflammation mediators like histamines, which in turn stimulate the inactive monocytes to become active, and they in turn turn into macrophages, and the macrophages eat whatever is bothering us, and then they release those pyrogens that bring a whole bunch of other white blood cells into the area, and the area just heals so wonderful. It's hard to describe. I mean, I witnessed it with my own eyes, and it is absolutely amazing how this immune system handles infection and pain and swelling, paralysis, all kinds of things. And in addition to that, activation of this non-specific immune system causes actual activation of a specific immune system response, which means that the body is starting to make antibodies to that particular pathogens. So then, they are particularly directed at that particular bacteria or virus or whatever is in there that should not be. So the whole immune system is like at its best. However, these reactions do not go forever. They are self-limiting, because at the same time when the body releases those inflammation mediating factors like histamines, it also releases factors that stop inflammation. And then the less of those inflammation mediating factors like histamines are in the area, the more of those inflammation stopping factors come to the area, and then the body just returns to the pre-disease state, to the baseline. So pretty much the body is like fighting the whatever is causing the problem and then bringing itself back to normal. I mean, isn't that amazing? That's just mind-blowing how our body is designed. The parts of the blood that are sucked into the cup and create this bruise, those little red blood cells that like leak through the capillaries and they are in the skin, like you can see like this bruise, this darkening, they in turn are being treated by the body as foreign objects. So that additionally creates this like stimulation of the immune system. So the body sees this foreign object and it says, we need to fight that. So that brings all the white blood cells to active state, and they clean whatever is in our body. That creates a natural response of immune system to a foreign object in the body. So we can compare it to like self-immunization. Actually, that's what medical community in different parts of the world is considering cupping. It's like self-immunization, because you create this like foreign body which makes your immune system to respond, and so you activate your immune system, and it's like having a vaccine, because then the immune system stays active for a certain period of time. So in addition to like, inflammation, disease, and so forth, cups are extremely effective in all kinds of physical therapy issues. Now there are different cups. There are fire cups, there are cold cups, and then there are which are glass, and then there are silicone cups. And I'll show you all of these. But for the fire cups, which this is a fire cup, you have you actually put fire inside to create this hot air inside, which decreases the pressure inside the cup and increases the temperature. So you have actually two factors that stimulate the immune system. You put it on, the low pressure sucks in the skin, and the hot temperature also affects the skin, and I find the fire cupping the most effective and the most enjoyable. Actually, this is my favorite kind of cupping, but for certain purposes it will be hard to use. So I'll show you the fire cupping, and I'll show you the low pressure cupping, and I'll show the silicone cupping. And now, since I explained why cupping works based on physiological response of the body, let's go over how to apply cups and when not to apply cups, and in what conditions they've been found to be most effective according to Dr. Narcis SADLON. And again, this review is based on the book. The book title is The Most Effective Weapon of the 21st Century, the Immune System. So, how to apply cups? You can apply cups several times. It's not just a one-time event. You can even apply it daily, depending on the condition and on the state of the patient. I personally prefer to do it like every other day. That is, I think, the preferred way. That is the preferred way that Dr. Narcis SADLON is recommending in his book. Like, if somebody is sick, do it like every other day. But when the cup leaves like this bruise, the basic principle is just don't put the second cup directly on the bruise, because that may cause a permanent discoloration of the area. So if you have to reapply the cups before the bruise is gone, then just apply it next to it in the areas that don't have bruise. And you can do that, or you can choose to do like wait till the bruise is gone completely and then put another set of cups. So those are the two ways to do it. Either apply it like daily, or wait till the bruising is gone and then apply it again. Of course, like with everything, if the cups like becomes too painful, you have to take it off. You have to make sure that like it's not causing like excessive pain. In general, like if you apply it to painful joints, you have to have some pain. It says there's no pain, that means that the cupping is not effective. So you are expected to experience some discomfort, but if it's too painful, then just take it off. When you apply the cups to the back, then the best position is to be laying down and resting. Your body, is undergoing this procedure, and you want to make sure that you are as restful as possible. So first, before you put the cups, you would like apply cream or lotion or anything. It doesn't really matter what it is. You just want something that will create the seal between the glass or silicone and the skin. My favorite is like castor oil, because it's so healing, or coconut oil or olive oil, or I'm gonna put some essential oils into like oregano, a drop or two, and mix it with the oil and then put it to the skin. And then before you do the cupping, you just massage the area gently to like increase the blood flow to the area and relax the muscles and relax the person or yourself. I do cupping for myself too, so that's what you do. First, you just relax the area. Like when you want to apply your the cups to like knees or muscles where you have pain, you would like check the area and find the most painful place, and then put the cup on the most painful place, because that means that there is the most inflammation and stagnation, and that's where you want the healing to happen. So you would find the most painful place and then put the cup on it and then around it. Now, once you place the cups, you cover the person with like a blanket. Keep the area warm. You keep away from any draft or anything. You don't want drafts, because you're very susceptible to like catching any cold or anything. So you want to make sure that all the windows are closed, doors are closed, and then you're covering the person with a blanket, or yourself. You're covering yourself with a blanket. Now, how long to keep the cups? Again, according to Dr. Narcis SADLON, that he gives the following times. Adults in generally like good health, not like compromised, you would keep the cupping for like between 15 and 20 minutes. Adults who are like severely sick, then for them you would keep the cups for 10 to 15 minutes. And children in ages 5 to 18, about 10 minutes. And children ages 1 to 5, about 5 to 7 minutes. And then infants and children up to 1 year old, you would do it for 2 to 5 minutes. Also, you want to make sure that you like give a glass of water before you do the cupping, because you want to make sure that you're hydrated, that the person that is undergoing cupping is well hydrated, and then give something to drink after the cupping. Now make sure that after cupping, when you take them off, like massage the area again and cover the person with the blanket and let them rest for like, at least 20 minutes, 2 hours. It's the best is to do the cupping in the evening so you can go to bed and sleep and just spend the whole night in bed. And don't plan like any heavy activities afterwards, because your body is gonna be working so hard on fighting the infection that you have to be reasonable. Your body is using that energy to stimulate this immune system, so you have to kind of ease off. Now there is another section in the book. Here it says where not to apply the cups, and most of all, you would not apply the cups in areas of large blood vessels that are close to the skin. It's kind of obvious. You don't want to rupture, you don't want to apply the cups where there's a large blood vessel close to the skin. You do not apply them close to the eyes, ears, and nose. Dr. SADLON doesn't recommend them on the face, on the moles, on the stomach, on abdomen, on varicose veins. Any area of the skin that is compromised, has some sort of disease, broken skin or wounds, you would not put on that. He recommends not putting it on birthmarks and over bony prominences. Also, do not apply it on a pregnant woman, and especially on the abdomen and the lower portion of the abdomen. Whenever somebody has like a problem with coagulation, you would not want to use cupping for that person either. If somebody has prolonged high fever and the body is compromised and the immune system is overreactive, that's when you would not want to use the cupping as well. Now, in what instances is cupping effective? Well, according to Dr. SADLON, again, he found cupping to be most effective in following cases. Viral generalized infections and respiratory infections, bronchitis, flu, pneumonia, runny nose, cold, sore throat, laryngitis, and so on. The next group of conditions that respond extremely well to cupping therapy is arthritis of joints and spine, sciatica, neurosis. Neurosis, the doctor found that it calms the person, and circulatory disorders, because it improves circulation. Also, digestive disorders, urinary tract and reproductive system disorders, headaches, migraine headaches, especially related to tension headaches, and ringing in the ears. And I want to stress one more time, keep in mind that cupping is not like a sole therapy. It's not supposed to like replace the medications you're on or so forth. Most of the time, cupping is used in addition as a complement with other therapies. So you like use everything you have to work for you. The cupping stops the pain, and it's just amazing. But the cupping actually stops the pain, especially in like chronic conditions of the spine, chronic arthritis of the spine, neuralgias, and rheumatoid inflammation of the joints, headaches that are related to pressure. So who would have thought that actually cupping is so effective for arthritis of the spine and the joints? Notice that cupping has been noted to help regulate sleep in people who suffer from insomnia. Now, the last subject that I want to cover in this section is basics of placing the cupping. So like in upper respiratory disorders and infections, you would place the cups on your back. In case of painful joints and spinal conditions, you would place the cups locally in that particular area that hurts. And again, as I said, you would apply cream and then put the cup on. You would let the person rest and keep warm away from drafts. The cup should create like a low bulging that is between 0.5 to 1 centimeter. 1 inch is 2.2 centimeters. So you want between 0.5 centimeter to 1 centimeter, which is about this much. Too much of a bulging may be dangerous, and too little of a bulging may be just ineffective. So this is the recommendation of Dr. SADLON. Other doctors may have different recommendations, but I'm just doing review of this book. So I'm just telling you 0.5 to 1 centimeter bulging is optimal bulging for a cup. And also in cases like when people get frequently sick with like upper respiratory tract infections and so forth, you can do the cupping prophylactically actually on a healthy person, like do it so my immune system would be active and I will not get sick. So that's like making myself self-immunization to make sure that I do not get sick, and that actually works too. So now I'm gonna go to the practical section of my videos, and I'm gonna show you the kinds of cupping that I have, the kind of cups that I have, and then how I apply them. Hope you enjoy this, and please join me for the other section and subscribe to my channel. Thank you.